Now, we know that Southern California is the plastic surgery capital of the world. More facelifts are performed here than anywhere else. What if you want to improve only a small part of your facial looks, or you feel the way this woman did?
I don't need a facelift. There's nothing to lift. I'm not ready for a facelift.
But Janice is a film actress, and she started to notice indentations in her cheeks, which she believed took the viewer's attention away from her best features.
It was taking away from my eyes, where I wanted everything to show was in the eyes. And I didn't like that look. It was like a hollowing, right in here. And, that's when I decided that I wanted to do something about it.
Janice saw Dr. William Binder, who told her that the old type of cheek implants probably wouldn't do the job for her.
Conventional cheek implants are basically two shapes. They're sort of like an oval shape, and there's others called anatomical type shapes. And what they are, they're cup-shaped, and they're made to fit specifically over the prominence of the cheekbone. And then,
believing that produced an angular, unnatural look, Dr. Binder helped develop a different type of implant, which would fit under the cheekbone instead.
You make an incision that's less than an inch under the lip, between the lip and the gum, and you raise the soft tissues up over the bone, and you just put in the little silicone implant right on the bone.
Dr. Binder feels that not only makes the change in appearance more natural, it produces other benefits as well. Nana Weinberg, who's a professional architect, understood the concept.
It's like the structure of a building, the beams and the columns that are holding the building up, and then after you put that on, you put the decoration on the outside of the building.
This is the framework that Nana was talking about. Once it's placed inside the cheek like this, it not only produces a prominent, visible cheekbone, but it provides a structure for the enhancement of future facelifts. It does so by providing a form and anchor over which to perform facelifts. The result becomes more apparent as the years go by.
The skin is pulled over a better bone structure. It holds longer, and it avoids that mask look, or what some people call that wind tunnel type effect that you get from multiple facelift procedures.
This is how Nana looked before her surgery. This was Janice's appearance. They both feel they made the right choice.
This adds to the bones. This gives people like me something maybe that we didn't have, or that kind of sagged a little with the years, but we get our bones back.
They really don't know what it is. They look and they just don't know what it is. It's just a whole new, it's youthful. You look a lot younger.
Now, here are the important disclaimers. The procedure isn't for everyone, and no surgical procedure should ever be taken lightly. We don't yet have long-term studies of 20 or 30 years to determine that these implants really do improve the look and success of facelifts. But if you don't need a facelift and you do want more prominent cheekbones, this might be the procedure for you. Remember our past advice about plastic surgery. If you think you want some performed, get a number of opinions and check on all of the doctor's credentials before proceeding.